OrigAMI-4 is a multi-cohort study that's looking at the EGFR MET bispecific antibody in head and neck cancer. So this use of EGFR inhibition in head and neck cancer is pretty well established. Cetuximab is a monoclonal antibody to EGFR that's been used either in treatment refractory disease, including after immunotherapy, or in combination with radiation. But we've understood for a long time that MET can upregulate after you inhibit EGFR, and that MET signaling mediates resistance. So it's been of interest to see if co-targeting EGFR and MET would be of utility in head and neck cancer. What I presented at ASCO this year was the final full results from cohort 1. This looked at Amivantamab alone in patients with recurrent metastatic head and neck squamous cell carcinoma that had previously been treated with an immune checkpoint inhibitor and a platinum chemotherapy agent. And so this is a pretty treatment refractory population. There are not other agents that have high response rates here. And we saw a blinded independent central review confirmed objective response rate of 42%, very similar to the investigator-assessed response rate of 47%. There were 15% of participants who had a complete response. Responses were pretty durable. The median duration of response hadn't been reached. And the overall survival was very impressive at 12.5 months. If you look at cetuximab, the sort of other EGFR inhibitor, in the post-immunotherapy setting, that has a median overall survival of 8.6 months. So it looked as if this was pretty active. We used a subcutaneous formulation of Amivantamab here, so the older data in lung done with an IV formulation, there were a lot of infusion-related reactions. Here we had an administration-related reaction rate of 15%, and they were all grade 1 or 2. There were no grade 3 administration reactions. There was one on study death due to pneumonitis, but overall this appeared to be very safe, no new safety signals compared with other data with subcutaneous Amivantamab, and a very, very impressive amount of clinical activity. So the data were simultaneously published in JCO. People can, see all the details, and also have been submitted to the FDA. We're also taking this forward in the first-line setting. So I mentioned OrigAMI-4 is a multi-cohort study. Cohort 2 looked at Amivantamab and pembrolizumab in first-line. That has been previously orally reported at the head and neck multidisciplinary meeting, has a response rate of 56%. And the phase 3 trial is going to take that forward with chemotherapy. So patients don't need to be PD-L1 selected, first-line recurrent metastatic disease, and they'll be randomized between chemo-pembro, a la KEYNOTE-048, or they'll get carboplatin, pembrolizumab, and Amivantamab. And that phase 3 study is ongoing.